Good evening and thanks for joining us for this special 5:30 edition. I'm Martina Bills. We're going to be spending the next 30 minutes talking about a health epidemic threatening our children. It's easy to hide and it's happening everywhere. Tonight, WSAZ investigates hidden danger. We're talking about the hidden dangers of electronic cigarettes, also known as vapes, marketed with appealing flavors like cotton candy, bubblegum, and blueberry. Health professionals are calling vaping among teens and young adults a health crisis. Now we're going to tell you a little bit about why. According to the American Heart Association, more than 3 million children use vapes in 2020. West Virginia ranking #1 in the nation for middle school age students who vape. The numbers are calculated differently in other states. For example, in Kentucky, more than 20% of 10th graders say they vape. And in Ohio, more than 20% of adults say they're addicted to vaping. The dangerous part, experts say, one vape can contain as much nicotine as an entire pack of cigarettes. Tonight, we'll hear from a lung surgeon about just how dangerous the chemicals kids inhaling truly are, and lawmakers who say change is necessary. We're looking at different ways vapes are exposing our children to hidden dangers. I recently traveled to Cincinnati Children's Hospital to sit down with a leading lung transplant surgeon. He knows firsthand just how serious the consequences can be. In fact, he's on a personal mission to educate parents about how kids and teens are impacted by the hidden dangers of electronic cigarettes.
Historically, I came from a family of smokers, and it's close to my heart. It's part of the reason why I went into the specialty I did. My father became addicted to nicotine as a child, and my mother was a little bit older, but still a child. And so I was exposed as a child to tobacco smoke, and I absolutely find it one of the most foulest things I've ever been exposed to.
Dr. Don Hayes at Cincinnati Children's Hospital has seen firsthand the hidden dangers of vaping.
We transplant children and young adults with this particular lung disease.
EVALI, an acute lung injury caused by vaping, was the first lung illness to put doctors on alert to the dangerous ramifications of electronic cigarettes.
It was later discovered that most of those cases were associated with a specific additive to the e-cigarette or the vaping device. It was vitamin E acetate. And so that was the primary culprit that was causing most of the lung injury. And so that ultimately was removed from these devices, and the rate of EVALI, the lung injury itself, dramatically went down. The issue is we continue to see that periodically.
The focus has now shifted to what has become known as popcorn lung. It's narrowing and thickening of the airways.
It's very similar to what some people may be familiar with chronic obstructive pulmonary disease, but it's a different format of lung disease. It will have similar types of symptoms and signs related to it. Now, the reason why they called it popcorn lung is that it was an occupational lung disease some years ago. People that were working in popcorn factories were developing this lung disease related to working in the factory. And so what they did during that time period, and again, it's good surveillance, public health surveillance, looking, seeing what was happening. It was an additive to the popcorn that was causing this. Now with e-cigarettes and vaping devices, guess what's in some of these additives? It's diacetyl. And so if diacetyl is in whatever you're vaping, there's a chance you could develop something similar or the same disease as popcorn lung or bronchiolitis obliterans.
You know, I think people typically think of smoking, whether it's a vape or a cigarette, to get the nicotine, but the amount of chemicals is way more than people even realize.
They add these other components to make it a stable product, a better tasting product, and anything that somebody would potentially buy off the shelf.
Have you been able to tell how long it takes until someone is really starting to see damage?
The long-term effect, we really don't know, but it could be anywhere between a little under a year or a few years.
Not only from a medical standpoint, but from a, as a parent, that alarms you when you're looking into just how dangerous something so small can be so dangerous.
What is the most surprising is the family members don't even realize it's going on. And so that's the key piece here that I keep on describing to people. Get engaged with your children and find out what they're doing, and find out what their friends are trying to get them to do, because that could do some damage pretty quickly.
Now, besides lung damage, Dr. Hayes stressed that vaping can also have severe complications to cardiovascular health, and the chemicals and heavy metals in a vape could also impact your brain.
We're going to look in the 2024 legislative session about maybe enacting some laws to reduce the targeting of kids in vaping.
From doctors to lawmakers, we'll have more here on WSAZ Investigates Hidden Danger right after the break. Welcome back to our special on the hidden dangers of vaping. The CEO of the West Virginia Behavioral Healthcare Providers Association admits 6 months ago he didn't know just how big of an issue vaping was among kids and teens. Mark Drennan's eye-opening conversation with a middle school principal propelled a strong sense for change.
Well, I have 2 kids of my own, so I have an 11-year-old and a 14-year-old, and we recently took my 11-year-old to tour a new school because we moved to a new area, and the principal was saying how vaping was such a huge problem in the middle schools. Being in our industry, I thought, I haven't heard much from our folks about vaping. So I thought I would bring it up at our next substance abuse committee meeting, and was shocked and surprised at some of the information that I heard. One of our areas said that their local school had 13 vaping overdoses the previous month.
So these healthcare providers, mental health care providers, behavioral health care providers, are seeing it just as problematic as we're starting to really take note of it.
Right, and it's so new. I mean, one of our members up in the northern part of the state has just started a program. They've interviewed 15 kids. 9 of those kids have engaged in vaping. They're getting it from their friends maybe getting it from other adults, maybe parents, maybe unscrupulous adults that are marking up and making a profit by selling this to young kids, from kids that on the lower economic scales to people in the arts, kids that are in sports. It's across the gamut.
Okay, so what would you say right now is a starting point to really work on improving this issue here in West Virginia?
Well, what we're really interested in is what we believe is the targeting of our youth. These vapes have pretty colors and they're bubblegum flavored, and so I think that what we're going to look at, we have a legislative committee, we're very active at the Capitol, is we're going to look in the 2024 legislative session about maybe enacting some laws to reduce the targeting of kids in vaping.
You heard some pretty astronomical numbers about how many overdoses just in West Virginia you have heard about.
The Office of Drug Control Policy announced that there were 700 overdoses in schools last year in West Virginia. That's an enormous number. I've reached out to 988, which is the new suicide hotline for West Virginia, and they're trying to track down these numbers. So these are things that we're going to start looking at on a regular basis, but we haven't yet. It's just that new.
What kind of rules and laws and punishments for these children? Their age group is so young compared to what they really comprehend.
Well, I talked to some of our prevention specialists, and they don't really think that you should be suspended for it, because then you're going home into maybe an environment where you're going to be vaping all day long. So you need to have some prevention, you need to have somebody to talk to them. Maybe there's some in-school suspension and some learning opportunities there versus just strict punishment.
So conspicuous. If someone was smoking a cigarette, it would be very obvious right here if you were smoking cigarettes before you came here today.
Right.
If you were vaping, I would have no idea. And
Right.
That's the other thing. Parents may not be aware because it's so hidden. It's so secretive.
Right, you got to ask your kids, and you have that discussion. And I sat down with mine and made them watch some videos. There was a gentleman, a young 17-year-old boy that had a double lung transplant. He was an athlete. He didn't vape all the time. He was a casual vapor, and he spent 21 days on life support before he got a double lung transplant.
Now, Mark Drennan plans to lobby during the upcoming West Virginia legislative session, working towards change. Meanwhile, one lawmaker is looking to expose the hidden dangers of vapes. Tom Takubo is a state senator from Kanawha County. He's also a pulmonologist.
So as a lung doctor, I have to combat the other end of the spectrum when people get addicted to nicotine products. And currently, in West Virginia, the top 3 out of 4 deaths are directly tobacco related. So when I hear that kids are getting addicted early, that we have the highest smoking rate amongst teenagers, it's heartbreaking.
Okay, now what would you say from your perspective as someone who, is an elected official and comes to the legislative session every year to help make this state better? What was something that would stand out to you with this, health epidemic that children are facing in West Virginia as a possible solution that you may see as something you guys could discuss?
As a legislator, I think we've got to educate legislators. So a lot of them, unfortunately, kind of feel the same thing, that it's not such a big deal, that vapes aren't as dangerous, and they are. It's a tough subject. We try to figure out how are we going to approach this in the legislature, and so people talk about, well, suspend these kids and do that, and it's almost like a day off work. Nobody's going to complain about that, but I would invite anybody that has strong ideals. The community's got to pull together and come up with the ideals, talk to their legislators about what we can do to tackle this problem.
So just how are children getting these products? West Virginia lawmakers say there's a loophole when it comes to underage sales. Let's break it down for you. So in 2019, a federal law went into effect making the tobacco age 21. That means retailers cannot sell tobacco products, which includes vapes, to anyone under the age of 21. But here's the problem. In West Virginia state code, that still lists the age at 18, even with a federal law in place of 21. Where this comes into play is from a law enforcement standpoint. State code prevents police from enforcing the sale of vapes to anyone under 21. A police officer in West Virginia can only legally cite someone for selling vapes or tobacco products to anyone under 18. That's not the case in Ohio. State lawmakers did adopt the federal age of 21. And a similar situation in Kentucky, where the Commonwealth also adopted the law of 21. Experts say the addiction is starting at a much younger age, and it's happening inside our schools.
The scary part for me is they pass these amongst each other freely.
Making schools safer here on WSAZ Investigates Hidden Dangers. Welcome back to WSAZ Investigates Hidden Danger. It's a priority for some to keep schools free from the hidden dangers of vaping. It's become the mission of the resource officer at Cabell Midland High School. Corporal Bill Templeton says he saw an increase in vaping when school went back to a normal schedule after the COVID-19 pandemic. He's keeping his promise, confiscating one vape at a time.
Last school year, I did 135 police reports at Cabell Midland. 62 of those reports were tobacco vapes and 26 were THC vapes. So half of all the reports were vape related.
You collect the vapes when you confiscate them,
yes,
and you save them as almost like to show how big of an issue it is.
Yeah, I use them for training, and we're going to try to do some preventative stuff. There's tobacco, which is the nicotine, and then you have the THC, which is Delta 8, and Delta 9, which is marijuana, basically, or synthetic marijuana.
So you said that these kind are the tobacco ones that are most popular.
Yeah, the Hyde, they're usually square like this. Now there's some little ones that are flatter, and they have ports that change in and out.
You said those are rechargeable too.
Yeah, you can plug them in, heat up the vapor, and then they use them, and they're mostly using in the bathroom, or they'll slide them in their sleeve and take a puff, and they usually get caught by someone at school.
Okay, what about the THC ones? Because they do look different, and obviously they're more dangerous.
Yes, those actually, if even a teacher, if they're not familiar with these. Some of these, and this one's kind of unique, but some of them look like ink pens, and you can't tell them apart. Now, these also have changeable ports where you can take this out and put in a new vial of THC, and this also heats up. But the effects of this is horrific on the kids.
And it's quite scary, I know, from any adult standpoint, whether you're the educator, the resource officer, or the parent, to even think that this stuff is happening every day.
Yeah, I have seen kids fall face first on concrete sidewalks. I've seen them attack inanimate objects like seats and chairs, not knowing it's not a person. I've seen them completely stagger around just like they were on some other type of drug, but it's the THC. They're hitting it too hard, I'm assuming, due to the consistency of the oil.
How does the process work to be able to confiscate and really actually write up the reports?
Well, usually the staff is the one that catches them. Most of the times it'll be a teacher, either on duty near the restroom. We think they kind of market to kids because some are cotton candy flavor, grape flavor. That's not really an adult type flavor. So you can smell some of those. So they usually get caught by a teacher or a principal, and then they call me in for follow-up. The scary part for me is they pass these amongst each other freely. Just taking them from random people, you just don't know what you're going to get. That's scary. As for helping them, on the tobacco ones, I do a program of community service. If the first offense, it follows the state code. First offense is 8 hours community service. Second offense is 16 and 24 for third. What I do is I give them the option of going with their parent to do this community service. They return it to me, and I don't file it through the prosecutor. And if it gets to the third time, I usually end up having to file a petition because I've tried everything to help them. Now, THC is a little different, but if I get one of these and it's not identifiable as Delta 8 or Delta 9, I'll file possession of controlled substance until it can be determined in the hearing.
The strong message inside our schools does not stop there. It's happening all across our region.
I was furious that somebody had laced that vape, and I was infuriated with her that she'd pass it on to someone else.
Emotional words from a high school principal leading the way. More when we return. Tonight, we are sharing the hidden dangers of vaping inside our schools, but some programs are helping to combat that epidemic. In fact, one school in our region receiving a national award in recognition of their efforts in technology and intervention strategies to reduce vaping. News Channel 3's Kimberly Kagi shares how Wayne High School is working to combat the dangers hidden in plain sight.
We had 2 students that overdosed and had to require Narcan.
Within a high school hallway, there's a danger hidden in plain sight. E-cigarettes with flavored nicotine have exploded with popularity amongst teens. December the 8th is a day Wayne High School principal Sarah Stapleton says she'll never forget after having to call 911 for 2 students.
I was furious that somebody had laced that vape, and I was infuriated with her that she'd pass it on to someone else.
Wayne High School has since installed vape detectors, which send an alert to a staff member's phone about where a vape is detected within the building. And because of that, the number of vapes confiscated within the district is growing.
But somewhere in this pile is that very first one that we collected on March 16th, 2022.
Derek Peterson helped develop the vape detector technology to combat the public health crisis in schools.
Look at that pile as a way to break my heart, that we even had to do something like this to create technology to prevent that pile. Obviously, it is successful that we're understanding when kids are vaping, but I wish the pile never existed.
Giving teachers and staff the ability to be
One step ahead. You're one step ahead of me.
working to protect teens from the dangers hidden in plain sight. Kimberly Kagi, WSAZ News Channel 3, Wayne County.
Tonight, we've been talking about the dangers of vaping and teens. So what do you do if your child has already started vaping? The program we're talking about is called This Is Quitting. the Tobacco Endgame. It's a local initiative and it's used inside schools that have partnered with the American Heart Association. It's a free text program that shows the real side of quitting by using information from other young people who have attempted to quit vaping before. You can text HEART to 88709 to get free advice, tips, and inspiration to quit vaping. That number will always be on our website.
Parents taking a step and looking online and reaching out and asking questions as well as what are the signs. Again, the irritability, staying in their room, quietness. It comes in so many forms, but to just honestly have that conversation with them, because the parents have to understand what the consequences are of vaping before they can really have that conversation with the student and to know how to move forward.
Doctors, lawmakers, and educators all working with one mission in mind: exposing hidden dangers found in vaping. Thanks for joining us for WSAZ's Investigation Special. We will update you on any additional programs and laws to keep kids safe.